Even before we take our first breath, we begin a journey that will last a lifetime. The process of human development. The starting place is pregnancy. For parents, a time of preparation for a new life. For the coming baby, the most important time in its development as a human being, the amazing process called prenatal development. Knowledge of what happens during pregnancy is crucial for a happy, healthy experience. In this program, part 1 in a series on child development, we'll guide you through these 9 months and show you what happens to most expectant mothers and the babies growing inside them. Once a month, a woman's ovaries release an ovum or egg. In about 2 days, the egg moves through the fallopian tubes to the uterus, the organ in which the baby develops during pregnancy. Conception occurs when an egg is fertilized by a sperm. This is the first of 3 stages of pregnancy, the zygote or fertilized egg stage. Over 2 weeks, the zygote finds its way to the uterus. The single zygote cell becomes 2, 2 becomes 4, until the zygote is a mass of cells about the size of the head of a pin. The second phase, the embryo stage, lasts from about the 3rd to the 8th week of pregnancy. The embryo begins developing what will become all the major systems of the human body: heart and lungs, bones and muscle. The next important milestone is the formation of a sac around the embryo filled with liquid called amniotic fluid. Next is development of the placenta, the thick layer of tissue between the walls of the uterus and the embryo. Its blood vessels carry food and oxygen from the mother's bloodstream to the baby's umbilical cord, then to the baby. The third and last stage of pregnancy is the fetus stage, which lasts from about the 8th or 9th week of pregnancy until the birth. As the fetus grows, so does the amount of amniotic fluid, the size of the uterus and the abdomen. This is when a woman may begin to show or look pregnant. Most babies develop normally and are born healthy. Sometimes, however, prenatal development doesn't proceed as planned. Some babies are born with birth defects, and although scientists don't fully understand all of them, they have identified 4 main causes: heredity, environment, abnormal genes, or chromosome errors. Prenatal tests can sometimes determine the probability of certain birth defects. Responsible parents-to-be take steps to minimize the chance of birth defects. Some causes can be controlled by avoiding alcohol, caffeine, inhalants and tobacco, most drugs and medications, and exposure to external hazards like radiation from X-rays. Good prenatal care is essential, so a woman who thinks that she may be pregnant should see a doctor immediately, either a general practitioner or an obstetrician, a doctor who specializes in pregnancy and childbirth.
The earlier a woman comes to see her physician after noticing that she's pregnant, the better. In the best of all possible worlds, she's already had an established relationship with the doctor, and she's told him or her that she's planning on getting pregnant.
Hi, my name's Christina. I have an appointment.
Hi, Christina.
Because a lot of times what we want to do is we want to go through their medical history and through their family history to make sure that there's not something that we can do to intervene ahead of time.
It's real important to get into prenatal care early, because if there are conditions that there could be some complications, there's some things that we can do to prevent them if we know that you're pregnant early.
I can have you fill this form right here.
On that first initial visit to her health care provider, a woman can expect to undergo an examination and a series of tests, which may range from simple blood work to more extensive procedures.
Christina?
They'll do regular things like height, weight checks. They'll listen to your heart. They'll do a physical exam.
So, Christina, how are you feeling?
I'm feeling
On the first prenatal visit, what we basically do is sit down and go over their family history, their medical history, see what kind of things they may be at risk for, so that we can target their prenatal care specifically towards them.
Everything looks good here except for the diabetes. We'll have
The
to watch.
prenatal lab, the blood work that we get, generally checks for your blood type. We want to make sure that you're not Rh negative. If you are Rh negative, there's a special shot that we'll give you at about 7 months, and then after delivery, depending on the blood type of the baby and the baby's father.
Many women worry about symptoms that they may experience during pregnancy.
I would say that most of the things that people experience would be bloating, breast tenderness, nausea, but most of those things will subside after the first trimester, and then they may come and go as the pregnancy progresses.
Nausea or morning sickness is the most common symptom in early pregnancy, although most women experience the first few weeks without complication.
At 11 weeks, I was feeling great. I had no nausea whatsoever. I didn't feel pregnant at all.
Sleeplessness because of hormonal changes is also fairly common. Remember, however, any severe symptoms should be reported to your healthcare provider immediately. During the first trimester of pregnancy, the period from conception through the 13th week, the embryo's brain is beginning to develop and the vital organs become apparent.
Most of the time, women don't even know they're pregnant until they're about 6 to 8 weeks. During that time, you've got early development occurring.
A woman who even thinks that she might be pregnant should avoid drugs, alcohol, and cigarettes because they can interfere with healthy fetal development.
The first trimester, the baby is growing all those little organs that it's going to need the rest of its life. And that's why I think that that's the most critical period to really avoid exposure to drugs, exposure to alcohol, cigarette smoking, because it's so susceptible to damage from those outside chemicals.
When a woman finds out that she's pregnant, it's extremely important for her to limit or completely cut out alcohol from her lifestyle. Alcohol can be a central nervous system depressant, and this has ongoing effects for the baby after delivery right through childhood.
We encourage no drugs, no alcohol, none of those things during pregnancy.
It's important for pregnant women not to smoke. Smoking causes an increase in carbon monoxide levels in the mother, and it goes through the mother's bloodstream across the placenta into the baby.
As soon as I found out I was pregnant, I stayed clear away from alcohol. I stayed clear away from secondhand smoke.
They say think of one little glass of wine or one little beer. All of those cross the placenta, and it can affect the nutrients to the baby. A lot of women don't know it affects the baby twice as much.
The single most important factor in prenatal care is good nutrition. By eating a balanced diet, an expectant mother helps her baby grow and develop normally, and she needs to protect her own health.
I do crave fruits, fresh things to put in my body because a lot of times I am very hot. By drinking water, eating fresh fruit, eating healthier things helps me feel a lot better.
I make sure I'm drinking more milk and I'm eating yogurt. I don't really care for yogurt, but you know the things you do for the baby. It's worth it.
It was very important for me to have a healthy diet. The midwives had instructed me on the food pyramid and told me to eat plenty of vegetables and fruits and grains, and that I needed to drink 8 to 10 glasses of water a day.
I recommend people follow the food pyramid. Up at the top of the pyramid is a very small amount, which is sugars and fats, and coming down the pyramid, people should have a couple of good protein servings per day, and that could be meat or fish, could be eggs or a fish substitute like beans or tofu. Also have maybe 3 cups of milk a day or a milk substitute like cheese or yogurt.
The baby is living inside of you, and it is zapping everything it needs from you. So if it needs iron, it's going to zap your iron. If it needs calcium, it's going to zap your calcium.
Vitamins help lower the risk of birth defects. Most doctors recommend a daily prenatal multivitamin with plenty of folic acid and a mineral supplement.
Is the doctor will determine if you need iron. Usually folic acid is always given because that helps prevent the neural tube defects. And in fact, we encourage women to start taking that even before the pregnancy.
The second trimester is the time from the 14th week through the 28th week. Although some women will experience complications and discomfort during the first trimester, in this second stage, most say they've never felt better.
This is the time when most women feel pretty darn good. They have the glow, their skin gets really clear, their hair and their nails get gorgeous, and they're pretty energetic because they don't have a lot of weight gain.
I felt absolutely wonderful. In my first trimester, I had had just a little bit of heartburn, but it had gone completely away in my second trimester. I felt wonderful. I felt like I could run a marathon. It was just great.
Along with a nutritious diet, moderate exercise can also make for a less complicated and comfortable pregnancy.
I really encourage my patients to exercise. If you start pregnancy having already been in an exercise program, that's the best of all possible worlds.
Physical activity is always very good. It reduces stress. It helps with some of the complications or side effects of pregnancy.
Walking is good, but on a regular basis, daily, every other day, 30 or 40 minutes per day, helps to normalize the metabolism, blood sugars. It helps to prevent diabetes in some people in pregnancies.
My husband and I try and walk at least a half a mile to a mile every night to stay fit and to keep the pregnancy going well.
Exercise also aids in the development of stamina for labor and delivery when that time comes.
With my first pregnancy with my son, I did a lot of walking, I did a lot of exercising, and that helped me dramatically in my delivery. I had a very short labor and delivery. It was great, and my doctor said a lot of that had to do with my exercising.
Labor is an aerobic activity. They don't call it labor for nothing. And so I think women who exercise regularly have much greater stamina and can survive much better if they have to push for 2 hours, which is not uncommon with your first baby. I think it gives them a good sense of well-being. It levels off the weight gain during pregnancy.
For the developing baby, the second or middle trimester is a time when the vital organs are really starting to take form.
That sounds good.
The baby's really putting on weight, and the organs are developing into their specialized form. So on a microscopic level, the liver tissue is really beginning to look like liver tissue, not like just some sort of rudimentary organ.
Yeah, he's moving real well.
Let me see your ankle here.
The last trimester is from about 28 weeks or 7 months till the end of pregnancy, which is generally about 40 weeks. And that's the time when the baby basically puts on weight and the organs just finish their specialization. So all of those things that really make the baby fit for life outside the womb are the things that occur.
And then my third trimester hit. And my third trimester, I was starting to get the heartburn, starting to feel heavy. My stomach was getting a lot bigger.
There's a lot of weight gain for the baby. They end up gaining about an ounce per day during the last couple of months of pregnancy.
During the final trimester of pregnancy, there can be changes in a woman's hormone levels, and she may experience drastic mood swings for no apparent reason. When this happens, it is important to know and understand that this is perfectly natural.
Emotionally, it's been a roller coaster. I would cry at the drop of the hat. I would have to go to the bathroom 20 times a day. It was very emotional. At first, it was no problem, but now it's become very emotional.
I am very sensitive, especially right now with my pregnancy. It's movies, commercials, you know, anything touching, I cry.
Books and literature on childbearing can be especially helpful during these last months of pregnancy.
The education part was very important to me as well. I began reading several books on what I should expect in my pregnancy and even postpartum.
Okay, deep breath in. Can I blow it out? Yeah, I feel that little pumpkin head down in there. Feels good.
During the last month, the baby shifts downward, usually upside down, with the head nestled in the mother's pelvis.
So he's headed in the right direction. Okay, great.
The baby is perfectly positioned now and ready for the big day. After 9 months, the time finally comes for the birth of the baby.
Labor is wonderful. Labor, I know. Labor is sort of like it's beginning of a marathon.
There are 3 distinct stages of labor. The first stage of labor begins with the opening of the cervix, the gateway between the uterus and the birth canal.
The hallmark of labor is that you have contractions and your cervix changes. So you can have contractions every 3 minutes that are killers, and if your cervix doesn't change, you're not really in labor. You might be in pre-labor, false labor, but you're not really in labor.
False labor is what I call trial run. The uterus is priming up to get ready for labor. You'll have these contractions that are real uncomfortable sometimes, and I encourage moms to breathe with them, relax with them, and they will come and they will go, and it's just the uterus saying, I'm not quite ready, but I'm thinking about getting ready. And you can have those as early as 36 to 38 weeks.
And basically what we're looking is for the cervix to dilate and for the baby to drop into the pelvis and get closer and closer to the outside world. Once you get into transitional labor, which is where you're 6, 7, 8, 9 centimeters, things get really quick. The cervix starts dilating faster, the contractions are closer, they're more intense.
Then you lay there, and it's pretty fun at first. And then contractions start, and you wonder why you decided to do this.
Luckily, it tends to go pretty fast, and then you get to complete, which is where you're 10 centimeters dilated. You're completely effaced, which means that the cervix is completely thinned out, and the baby is deep in the pelvis, and then you start pushing.
Once in the second stage of labor, it may be necessary to push for extended amounts of time. This is considered normal, especially for first-time deliveries.
Once the baby is crowning, the head is visible from the outside, that's where we step in and we assist with the delivery. So now you've reached the joyous event, the baby's presented to you, we've cut the cord, we've given you the baby, and now my job is to deliver the placenta.
Some births don't progress through these 3 stages as they should. If any complications arise during labor, the doctor may decide to perform a cesarean section, a surgical procedure that delivers the baby through an incision in the mother's abdomen.
We're going to give them every chance to have a normal vaginal delivery, but if it looks like it's becoming dangerous for them or the baby, then we'll opt for the cesarean section as the alternative route.
Birth is a momentous undertaking for both mother and baby. In most cases, delivery is problem-free, and the joyous moment comes when the new parents are given their baby to hold.
Ooh, bless you.
There's a recovery period. Generally, the nurses will check you very frequently over the first 15 to 30 minutes, and then it gets a little bit farther apart as far as the checkups. And then ultimately, after an hour, hour and a half, they leave you alone with your baby and the happy family, and you can enjoy your baby.
While the newborn must adjust to a whole new world, the mother needs adjustment time too. In a matter of hours, her body has gone from full pregnancy through labor and delivery and back to a non-pregnant state.
Now, depending if you deliver vaginally or C-section, it's real important that you take care and nurture yourself and get a lot of help.
Although she may feel excited, she's also probably exhausted. She must recuperate so she can care for her new baby. This can be accomplished by resting, exercising, and eating right, especially if she's breastfeeding the baby.
You shouldn't have to worry about cleaning or cooking or anything like that, because you really do need to focus on taking care of the baby. So spend a lot of time in getting your needs met by asking somebody to help you.
About 4 to 6 weeks after the birth, the new mother should see her doctor for a postnatal exam.
One area that's often overlooked is the postpartum exam. A lot of patients feel great. They don't see any reason to really come and see me, but it's really important. If you've had a cesarean section, it is a surgical procedure, and so we need to make sure that you're recovering from the surgery.
Lisa, how are we doing?
Are you having any complications like problems with your breast? Are you having any problems using the bathroom? Those are the things that you'll be monitoring to make sure they go back to normal.
Some new mothers get the baby blues, a few days of mild depression after the birth.
About sleeping, about the things you go through after you have your baby. Right.
This is the time when I do a lot of screening for postpartum depression, and I don't actually ask them, are you tearful, are you withdrawn? I basically just do it in a conversational style so that I can get an idea of how the baby and the mother and the father and the extended family are coping and handling each other.
No one really knows exactly why this happens, but by taking good care of herself, seeking support, and getting needed sleep, a new mother can minimize chances of experiencing the blues.
What are you doing, sweetie? Hi.
Having a baby is a joyous event, and the birth is just the first step in an exciting journey that lasts a lifetime.
Well, one of the things is to learn a lot about the baby before the baby comes. Getting those books, finding out what's normal for that first year of life. Learn it before you get into it.
Parents now face the first 12 months of the baby's life and the wonderful world of child development.
Alright, so we're going to look at signs of pregnancy. So there are multiple signs of pregnancy. Some of them include the absence of menstruation, the fullness of breast, nausea and vomiting, frequent urination, a positive pregnancy test, excessive need of sleep, and then quickening. So we're going to go over these different signs of pregnancy. So this is the most common sign. If you are a woman and have been sexually active, and your period is more than 14 days late, there is a good probability of pregnancy. Missing a second period, there is an even higher probability. Having lighter or shorter periods than normal can also be a sign of pregnancy. However, a missed menstrual period is not a 100% sure sign of pregnancy. There are a lot of factors that can cause this, and some of them include having emotional stress, if there's changes in the climate, your diet or exercise, if you become, I guess the word would be more active in exercising, like athletes, gymnasts, they usually stop menstruating because of their body hormones. Changes in your body weight, if you have an eating disorder, or chronic diseases such as anemia. These are also characteristics that can cause an absence of menstruation that does not mean you're pregnant. So just keep that in mind. That's not 100% if you are late on your period. Alright, so another one is fullness of breasts. They are going to become larger to accommodate breast milk. These changes are going to start to begin early in the pregnancy. They're going to swell. They're going to be tender and sore. However, again, swelling of breasts, tenderness are not 100% guarantee you are pregnant. Some women have these issues before their period. So, again, it's not a sign of pregnancy that's 100%. These are just different signs that could be pregnancy. Nausea and vomiting, also known as morning sickness. However, despite the name morning sickness, it can occur at any time of the day. About 1 in every 3 women have nausea that's severe enough to cause vomiting. 1 in 3 women experience occasional or mild nausea, and then the other third of women feel no nausea at all. Having poor diet, an empty stomach may also lead to nausea. So the doctors will probably tell you a way to combat this is to get plenty of sleep, eat nutritious meals, and stay hydrated. There is a condition where you have severe nausea and violent vomiting during pregnancy, and that prevents the women from eating food and drinking fluids. This is a serious condition because it risks the strain of having a safe pregnancy, because if you're not keeping your fluids down or your nutrients down, you're starving the baby of these nutrients. So there may be, make sure that you do go to the doctors and let them know that if you are severe experiencing HG. Frequent urination. As your uterus grows, it starts to push against the bladder, and that pressure on the bladder is going to cause most women to have to urinate more frequently. Another way to test if you are pregnant is a pregnancy test. If you have a positive pregnancy test, you're more than likely pregnant. Now, a positive pregnancy test is not 100% accurate. You could have false positives, and you can also have false negatives. So if you do have a positive, the best thing to do, the next step, is to go to the doctors and have them have a more clinical pregnancy test to make sure that you are in fact pregnant. A pregnancy test is used to confirm pregnancy. A hormone called HCG is secreted by the blastocyst as early as a week after conception. So a pregnancy test uses antibodies to react to the HCG in the blood or urine sample. If you are pregnant, your body will produce your HCG hormone. If the HCG is too low, it will not show up that the woman is pregnant. This could mean that you've taken the pregnancy test too early in the pregnancy. So this is where over-the-counter pregnancy tests are sometimes inaccurate. But people do use them on a regular basis because they are available over the counter. You can just get them at any Walgreens. They are inexpensive, and they are about 97% accurate if you follow all the instructions correctly and you read the results on time. If you let the results sit for a couple of hours, you're going to have a false test reading. Excessive need of sleep. Feeling tired as your body's adjusting to pregnancy. You are going to need to sleep more usual, and you probably will start to need to take more naps throughout the day. This is your body's working around the clock to build this supportive environment for your baby. Your heart's going to pump harder, your body temperature is going to raise, and fatigue can set in very quickly. However, again, like all the other ones, fatigue is not a sure sign of pregnancy. There are a lot of reasons that you could be fatigued, so just keep that in mind. Alright, so the next one is quickening. This is a sensation of movement in the abdomen, and it's known as quickening. And although the baby has been moving and kicking around for a few weeks, it's not until week 16 that you can actually start to feel any wigglings. And it kind of feels like if you're going on a roller coaster ride and you go down, you get that little whoosh of butterflies in your stomach. Some women report feeling this as earlier, and then most don't notice it until about 20 weeks or so. So now we're going to look at the impact of pregnancy on the family. So just keep in mind that parenting is a 24-hour-a-day job, and it impacts all roles within the family. One of the things that I like to stress when we talk about family planning and things like that is that bringing a baby into a dysfunctional or a broken family is not going to fix this family. Even the most secure and the most well put together family is going to fluctuate because there's so many changes that's going to happen. In a broken family, or a family where there's abuse or just bad marriage or whatever, bringing a child into that family is not going to put a band-aid on it. It's actually going to make it even worse, and it'll make it a lot harder for everyone to do the roles that they need to do in order to be a functioning family. So there are 5 adjustments each family needs to make, and these are the categories. There's emotional, there's financial, there's physical, and then there's the social aspect. So thinking about this, I want you to kind of imagine which adjustments would be the most difficult to make. Which would be the easiest, and why do you think that? What resources could families use to help make these adjustments? What could happen if families and parents are unable to make these adjustments?